A new CDC report this morning says millions of American women are binge drinking, putting their health and even their lives at risk. The study reveals that nearly 14 million women binge drink, about 3 times a month, having an average of 6 alcoholic beverages at one sitting. Dr. Janet Taylor is a psychiatrist who treats addiction, and she joins us at the table. Hello, Dr. Taylor.
Good morning.
So first, let's break it down. What exactly is binge drinking, and does that make you an alcoholic?
Well, binge drinking is for women, when you consume more than 4 drinks in 2 hours, and it does not make you an alcoholic, although certainly it indicates that you may have problematic drinking.
Mm-hmm. Why are women binge drinking at such high numbers?
Well, there are a couple reasons. I mean, binge drinking, between the ages of 18 to 22, people report they binge drink because they're bored. So certainly women would fall in that category. From 22 to 30, because they're trying to escape something, maybe from work. So certainly more women in the workplace. People feel pressure. They come on the weekends usually and, throw back 4 drinks in 2 hours and take the stress off. And certainly we want to close a gender gap, but not by these troubling numbers of more women drinking alcohol.
But, I feel that I have heard this story for many years about women drinking excessively. What makes this different now?
Well, what makes it different now is that we know that when women drink and do binge drinking or have chronic alcohol or alcoholics, it does more damage to our bodies than men. For example, we have it increases the risk of breast cancer, hypertension, cardiovascular disease, dementia, so brain disorders. So we are really doing tremendous damage, even though we can consume less alcohol and do more damage. Some studies even suggest that women alcoholics die at higher rates than male alcoholics. So people really need to understand what's happening.
I also thought it was interesting the report says that more white and Hispanic women with incomes over $75,000 are binge drinking. Why is that?
Well, whites typically begin drinking earlier, and because they begin drinking at earlier ages, they're younger, maybe early teens, they are more likely to go into either binge drinking or chronic alcoholism. So that's where it puts the risk. Hispanics, it's thought, because of acculturation and trying to fit in, are drinking. And the 75,000, I mean, if you think about it, if you have an income where maybe you can sit at home and work or go out on the weekends, you're still stressed, and so it still follows that you're trying to escape something.
And you have a problem when?
Well, you have a problem when risky drinking, and I have a lot of friends who may say this, I might qualify as this, but if you drink more than 7 drinks a week or 3 in a day or are binge drinking, then that's risky drinking. So certainly you need to do an assessment and look at how much you're drinking. But if you find that you're drinking to escape, you find that you can't stop, that you go into withdrawal or tolerance, or you avoid your usual activities, you're not going to work, relationships are suffering, you may have a problem and you need to talk to your healthcare provider.
Dr. Taylor, great to see you. Good information. Thank you so much.